Good afternoon and good evening, dear friends and guests. Thank you so much for joining for this episode of the Emerging Future series. Uh, this series, which is more a labor of love, is also a way of bringing ideas and values of people who have done tremendous good in the public space and bringing it to friends and family. I must also confess honestly that today I'm a little nervous also, and I will reveal as during the course of today's discussion why I'm a little nervous. My guest today, especially, is Dr. Praveen Chandra. Before I introduce him, may I request all of you to keep your microphones muted. You may pose your questions to Dr. Chandra in the Q&A section, which there is a button at the bottom of this panel in front of you on your computers. And if you have just a comment or an observation, that you can include in the chat section. So that way I am able to differentiate between observations and comments and your questions also. And a recording of this session will also be made available to you. Give me about 2 days to process it, and then I'll send you a link to the recording. Dr. Chandra, thank you so much for joining us today. Really special today for me. And this is also unique. And I mentioned I'm a little nervous because this is the first time ever that I'm actually having a Padam Shri awardee with me on this session. So thank you so much. It's for me also a very special honor. And more reasons for my nervousness I will reveal a little later. By way of introduction for our listeners, Dr. Praveen Chandra is a leading cardiologist and chairman of interventional cardiology at Medanta Medicity in India. He is recognized as one of the leaders in the field of angioplasty in India and also has done a lot of work worldwide. He is proficient in a lot of new devices, techniques, and technologies. For his numerous firsts and the successful care of hundreds of patients, he was honored by the Padam Shri by the President of India in 2016. In fact, Praveenji, hopefully sometime we'll also hear that many of the presidents in our country have actually been treated by you for heart-related ailments. So that's hopefully something that we will touch later today. Dr. Chandra also has many firsts to his name. And for the first time, for example, in India, he has done the percutaneous aortic valve implantation, which is without surgery, and the first ever percutaneous mitral valve repair. And these two things, I understand, these are especially relevant and significant for India because India has the highest number of valvular cases in the world. So in that sense, this is especially significant in India. Further, I'm told here that you were the first one to use jet thrombectomy. Do excuse my pronunciation devices. You started a percutaneous myocardial laser vascularization program in Asia, and you were the first one to use bioabsorbing stents in the country. So a lot of these firsts. You're also, I understand, a fellow of the Endovascular Intervention Society in India and in Asia, and the Asia Pacific Society for Interventional Cardiology. Dr. Chandra is also the distinguished faculty and often speaks in global forums on wide and varied matters related to coronary care. He has published over 100 articles, reviews, and abstracts in various national and international journals. I understand that you are also an honorary member of cardiology societies in Americas, Europe, and Asia Pacific, and of course across India. So thank you very much, Dr. Chandra, Praveenji, as I take the liberty of always calling you. So thank you so much for joining us. I feel really honored and also humbled by your presence amongst us. First of all, I know that you come from a very illustrious family of physicians who've done tremendous work in our society. You come from Gorakhpur, where I understand your father also had a very thriving practice. So, what you brought you from Gorakhpur and your journey to Delhi in this?
Thank you, Vimalji. I think that was very kind of you to give me this opportunity today to have this conversation and share some, some of this information and some of the thoughts which we have today. And I will be very happy to answer many questions at the end of the session. So, first of all, you said that, I come from Gorakhpur. Yes, I do. And I'm so proud that I'm from there. And my family is a doctor's family, actually. And that exactly led me to take medicine. So this is the basis on which I took medicine, because I always thought that medicine, and everybody told me that medicine is a noble profession, and I thought that it gives so much of recognition and respect. It may not bring so much money, but certainly recognition and respect is something which you cherish your whole life and you enjoy it. So I do that actually, and I'm very
Wonderful.
happy that I chose medicine. And if I
Excellent.
am born again, maybe I'll take medicine again. So that
Fantastic.
is how much I enjoy medicine. And it it all actually transgressed all these ideas from my grandfather, who was a doctor, and my father, who was a practitioner also. And so that's how it came into my blood. Okay.
Wonderful. So,
So
so
now
what
the
brought you
question
from
comes.
from
Yeah.
Gorakhpur to Delhi?
Yeah, so I was supposed to go back to Gorakhpur after my studies from King George's Medical College in Lucknow, where I did my MBBS, MD, and then after that I did my specialty in cardiology in from KGMC. And thereafter I was supposed to definitely was destined to go back to Gorakhpur to start a practice, because cardiology was very unknown field. There was nothing happening everywhere in the country, and it was really very at the starting point, I must say. It had not even started at that time. The only test which was done in the entire country was a ECG. If
Mhm.
somebody had a heart attack, the ECG was the only thing. So once I got trained, I was supposed to go there, but then certain things came to my mind. And the thing which came to my mind was that what is more prestigious, what is more fulfilling, what is more professionally enriching. So at that time there were two choices. One, either to join a medical college and go up the ladder in the the academics, and the second was to join a private practice. The disadvantage in practice was that you are still limited to a very small area of people, and also the professional satisfaction was not enough, because
Mhm.
the equipments, the infrastructure, one could not develop in private practice, in clinics, or a nursing home at the most. So that was the disadvantage. The second was in medical college, the problem was the hierarchy was very difficult to actually go on to that. And the second was the government system was really crumbling the entire country. Like you see that.
Yeah.
So there were hardly these district hospitals or even medical colleges were not doing so high level work. It was very difficult to get a technology to a medical college and then actually run it. So
Mhm.
then I said, what is the midway? And one of my friends who was also doing cardiac surgery, so we both sat together one day and we said, what is there something which brings these two things together? And
Uh-huh.
then at that time, Escorts Hospital was really coming up very fast,
Mhm.
and said, okay, let's go and try. So I went to Escorts to see what exactly it is. And then I found that the infrastructure was super. The equipments were top class, and you could do all that with your own hands without any hierarchical issues. So then I decided, and he also decided, let's go to a institution. So an institution which is well funded, well oiled, and you can perform the best of the techniques and bring best of the technologies and that is how I joined institutional hospital, which was a Scots hospital, in April of 1992. My professor was very unhappy that
Acha.
did I join this? I should have joined a medical college, but that's how it was.
Wonderful, So I remember in one of my conversations with you, you had mentioned that you especially look at coronary care without surgery, or like how to take care of your heart without surgery. Can you elaborate on that for our listeners as to what that is and what is the whole concept now which is emerging on heart care? Mhm.
Yeah, so in heart care, earlier when I started by my career, the only treatment was bringing the patient in a ICU, and he used to stay, once there was a heart attack, he used to stay in the ICU for 7, 8 days, and many would perish, some would survive. And at that time, the mortality rate, means how many people will survive a heart attack, was only 50%. And that was
Wow.
everywhere. But then ICUs, the CCU care or intensive care actually improved a little bit, but not to that extent. And at that time, angiography or angioplasty or bypass was unknown. And during this time, when I started my career in 1989, when I went to medicine, and then in 1990 when I started my DM, it was really very sparse. The facilities were like one or two places in the country, and that too very little.
Mhm.
So, and also at that time, that was one of the turning points. At that time, a lot of people had to go out of country to get a
Okay.
heart treatment done. In fact, many people used to go to UK, many people used to go to United States to get their heart bypass surgeries done or some other treatments done for the heart ailments.
Mhm.
So that was the situation, and not everybody could go. And at the same time, my father also had a heart problem, and then he had to travel out. And that time, even foreign currency was a big problem. So we had to
Yes.
arrange it from Reserve Bank and all those stuff. So it was quite difficult. And then, then when he came back, we saw that angioplasty was done. And that was the time when angioplasty also had started in Europe. So
Okay.
that gave me a kind of idea in mind, why not go into this field, which was totally unexplored, and would really treat very high risk patients. And the heart disease is still considered as the biggest killer of mankind in the entire world,
Okay.
beyond any wars, beyond any, not even corona, I must say. The heart
Mhm.
disease kills so many people worldwide.
Mhm.
So to really bring it down, and that's what I have been doing for the last now more than 25 years, to
Okay.
work in this field and really, bring technologies, bring new treatment options for patients who can lead a better life and a longer life.
Sure. So, coming back to the same question, one is that you can go for surgery or angioplasty, but how to recognize that? Otherwise, I
Yeah.
feel healthy. One, how do I recognize that I'm really healthy because I don't see my heart inside? And what are those symptoms that I should be looking out for?
Okay. So let me tell you, heart is a very difficult kind of disease. It comes in without any warning signs. That you hear that somebody was traveling in a train, somebody was flying in a plane, or somebody is working in office, or maybe sleeping in the bed, and suddenly he dies, or develops a severe heart attack in the middle of the night. So the question here is how to prevent this heart attack thing. That is the most important thing, because once people develop a heart attack, certainly we do things I will tell you later, but to prevent a heart attack and to recognize the early symptoms is the key.
Okay.
So the most important thing we have realized is that those people who have diabetes,
Mhm.
those people who have high blood pressure, those people who are smoking, those people who have family history of heart disease, and those people who have cholesterol, high cholesterol. These are 5 things. So if these things are under control, of course you cannot control your family history. That will
Sure.
stay with you for the whole life. But rest of the modifiable factors we can do. So if
Okay.
somebody has a sugar or a diabetes, he should control sugar.
Okay.
Definitely by diet, by exercise, and by medications. If somebody has high blood pressure, he should check his blood pressure regularly and keep it under control. The biggest problem is people who have high blood pressure in the initial stages, they think that they should not take medicine because they have to take it for the whole life. And
Sure.
that is the real problem, because the damage is being done, because high blood pressure and sugar or diabetes are the silent killers. They really affect the heart from inside. It is like, some these woodworms, they keep cutting the wood from inside, and suddenly one day you find that there is nothing inside. So sugar, high blood pressure has to be controlled, has to be checked. People don't even check it because they think that if it is high, they have to take medicine. So it is a very difficult. So this is very important. I keep telling everybody that do not shy away, do not keep yourself in dark. Please do that. The third thing is smoking certainly has come down in the world, but smoking certainly is one of the very strong risk factors which affects the heart, which leads to cancer and also leads to lung disease, very bad lung disease, and then nothing can be done. So if these three things are curtailed, life is going to be better. Then the fourth thing is the high cholesterol. Now, what is the symptom of high cholesterol? There is no symptom of high cholesterol. You can only know if you do a blood test. So anybody who is above the age of 35 years must get a lipid test done, lipid profile test done, or a cholesterol test done, at least starting from the age of 35 years, and then do it every 5 years.
Okay.
Okay.
Mhm.
And especially those patients, those individuals who have family history of heart problems, or they have sugar, or they have hypertension. So they are cumulative. So more risk factors you have, the more chance of heart disease. So if one prevents this, we believe that 20% mortality reduction happens just by this. There is no medicine involved in this, nothing. So this is very important, but
Mhm.
people don't realize how important it is, and to
Mhm.
start it early,
Okay.
because after
Mhm.
the age of 60, 55, people start taking medicine. That's not good.
Mhm.
At a younger age,
Mhm.
because we Asians, Indians,
Mhm.
are more exposed to a early onset of heart disease. That is a big problem.
Is that genetic, or is that
Yeah.
what is the
So
reason that for Indians it's more so?
yeah. So we really do not know what is the reason. We call it, there are two, three theories. One is a thrifty gene hypothesis. Thrifty
Mhm.
gene means genetically, we are not supposed to eat better. We are not supposed to do good things. So basically,
We are
genetically, we are
thrifty.
supposed to lead a very frugal life.
Okay.
You understand what I mean?
Yeah.
So this is the genetic predisposition which exposes us to have heart disease at an earlier age. That is one hypothesis. The
Mhm.
second is that in our country malnutrition is another big problem which has been there, and that leads to this. Third is recurrent infection. Infection has also been related to occurrence of heart disease, infection in the mouth, infection in the stomach, and then people develop all that and goes to the heart. So that is one
Okay.
of the hypotheses. But overall, main five things I told you.
Okay.
Now there was a study done in India,
Mhm.
and it was an international study, and a large number of patients were from India. This is known as the inter-heart study. Now, what happened in this study? What did we find? Which was done for in Indian patients, because Indians were getting heart disease so early and so bad.
Mhm.
The death rate in Indian patients was higher. So we did the study and found three more factors. One was that we exercised less. Lack of physical activity was one very important factor.
Yeah.
Number two was decreased intake of fruits and vegetables. So people took less fruits, less vegetables. That is why it is increasing, and that's why people ask why my forefathers lived for
Mhm.
this many years and then now I'm living lesser, etc.
Mhm.
So that is one of the causes, and the third main cause which was found in this was stress, increased mental stress, because we were competing, or we were looking at the westernized societies. Now what happens is that we have this race to achieve something, to get more money, and the more consumables, more electronics, etc., and bigger cars. So that was the stress which was on the entire nation and every individual. So everybody wanted to grow faster. So that is the stress factor. So these three factors are very important for Indians. So we have to reduce stress by some ways or the other, which we will discuss a little later.
Sure. Mhm. Thank you so much. Maybe this is a good time to ask the next question, actually, which has come in from one of our viewers here in Delhi. And the question is, she's asking, uh, heart care for healthy people, you mentioned some precautions, etc. But those of who may have already gone through an angioplasty or a bypass surgery, who are already having some heart conditions, that complicated further now with the lockdown and the COVID-19, etc. Uh, any special precautions for those who already have some underlying heart conditions?
Yeah.
What can they do?
So, yeah, this is a very good question. And many times, many patients are actually calling me that I'm your heart patient for a long time. Do I do anything special?
Mhm.
My answer is no. You don't have to do anything special, but please keep taking your medicines regularly. Keep your sugar under control. Keep your blood pressure under control by going for a regular walk, because many people have stopped walking. They do not go out because the scare of corona. But I recommend to them that you please take precautions, go out, start walking, and control your sugar, control your blood pressure, keep checking, because they are neither going for a sugar checkup, neither they are getting their blood pressure checkup. So everything is going haywire. So
Okay.
that has to be done. That is the most important thing. There is no extra medicine to be taken. There is no extra supplementations to be taken, because many times people have started taking this kadha, that kadha, multiple other things, and then the blood pressure is getting fluctuated.
Okay.
So that is why it is very important that please do your regular medications, do the regular
Mhm.
the social distancing,
Mhm.
mask application, and just take care of yourself by these things and eat well.
Okay. This brings me actually to a related question, which I was having in mind. That today we hear, and WhatsApp is very good at this, sending around concoctions, some immunity boosters, and some recipes for ये खाने से आपकी मतलब वो सेहत ठीक हो जाएगी. So, what is your Chawanprash, for example, has had several times more sale in the summers, which they never had.
Yeah,
So, what's about all this?
I think that's just an overreaction to the thought that your immunity should be good. So people are misutilizing this information, and they are trying to sell products which are really not really required. So the immunity remains okay if you keep everything in the body okay by controlling your, as I said, those factors,
Those five
and also,
factors.
yeah, and also taking a regular diet, balanced diet, nutritional diet, that's all. And if somebody has some kind of a deficiency, he can really take that. But overall, I will say there is no need to take such extra doses of immunity boosters. They are kind of placebo, I must say. They are of really, there is no proof that they really help.
So,
It's a waste of.
so when I, I must honestly confess, started taking some haldi with shahad and with some ginger juice and some other things in it. You think there is no evidence around these things? Is there? I mean, if
As I said,
nothing else, it tastes good.
if it tastes good, that's fine. If you enjoy whatever you enjoy taking it, it's okay. Maybe it is reducing the stress. I mean, that way. So if it is taking your stress off, that nothing is going to happen to you, I'm happy, that's okay. If it makes you happy, I'm happy. But if it comes at 1,000 rupees a spoon, then I don't think you should take it. That's the.
Okay, understood. Thank you. So coming back to one of the points that I made in the introductions, can you tell us a little more about some of these newer things that you're doing, especially this percutaneous aortic valve implantation? Not so much about the technique, but why this is important and what is unique about it, which earlier we were not doing, and this is so maybe the listeners can understand better of what the options are today.
Yeah. So, up till now, as I started with the historical progress of treatment of heart ailments, the first step was medicines. But medicines had their own limitations. They could only protect to a certain extent. And then we realized by doing investigations like angiography, which actually started coming up in India in the late 80s, and then in 90s it became more popular. Then only people knew how to identify why what causes heart attacks. So heart attack is caused by blockages in the heart arteries, and on those blockages clot formation used to happen. So we realized that if we remove the blockages, so the first treatment option which was brought forward was a bypass surgery. So bypass surgery started in about 1980s, and then through the 90s and 2000s it was quite popular. But bypass was a long-term like it used to take 2 to 3 months to recover, and then it is a mid-cut. And in some young person like 55, 60 or so, if there is a cut, if the pain lingers for the whole life, so those things used to happen, and many people would not actually survive a heart attack or a bypass surgery. So then this was the need, that we want something which is less invasive, less intrusive. And then angioplasty started. Angioplasty is the treatment where we open the blockages without doing surgery. So that was the starting point, and this is known as interventional cardiology, which I do. So this therapy was very unknown at that time, and then gradually it developed, and it was so easy. Patient goes in, comes in the morning, goes back the next day, and the treatment is done, and he can lead a good life and continue taking medicines. No pain, nothing, no stitch, no cut, no pain. So this is angioplasty, and it worked very well. So we started with opening one blockages, and then we progressed. We said, okay, it works in one, why not two, and then three, and then of course, now you see that the number of bypass surgeries worldwide have dropped. I mean, in fact, the cardiac surgery departments have shrunk because angioplasty has really taken the treatment option for heart blockages very, very far, and almost 90% situations are treated by angioplasties these days. And it can be done starting from the age of 25 or 30, going up to the age of 90, 95. And I have done personally angioplasty in a patient who was 98 years. Can you believe it? So in
98
bypass
years.
surgery had a limitation. It was, to be done in between the age of 50 to 70, 75. Beyond that, the risks were too high. So that is why angioplasty came into the picture. And this is the non-invasive nature. No anesthesia, no cut, no stitch. Then we became more aggressive. We said, okay, if we can open blockages, why not do the valve problems? Because heart has valves. And the number of, as you mentioned, the heart valve patients in India are very many. So at that time, the only treatment was for heart valve was surgery. And surgery again is such an invasive procedure. So then we started ballooning the valves. So if there is a valve which was shrunk, just balloon it, next day patient goes home. Works well for 10, 15 years, again comes back, no problem. Now, then we started, when this became successful, we said, okay, can we replace a valve without surgery? Now, this was very, very unique thought, which came to a person, I'll tell you, this was in France, Dr. Crevier, where I trained. And I was training in his hospital. This is in Rouen, 100 kilometers from Paris. So one day in the evening, he showed me a small ring made of steel, and there was something stitched on that. He showed me. He said, you know what it is? I said, looks like a valve made out of this thing. So he said, yeah. So we are doing experiments. So the first experiment was done when I was there. This was year 1995.
Okay.
In Paris, the first valve, and this was put in sheep. And when he came back after a few sheeps, he said, yeah, this is working. I mean, this valve is staying there without doing surgery. So this was very, very surprising for us. And then gradually this, the thought, this idea developed. And now today, we are able to replace the heart valve, which is known as the percutaneous aortic valve treatment, replace a valve inside the heart without doing any surgery. We do no cut, we do no stitch, no anesthesia, and the valve is replaced. It takes about 1 hour to do this, and the patients can go out in 2 to 3 days. And it is usually done to those patients who cannot undergo surgery. For example, anybody who's above 70 years, 75 years, we do it. And again, the maximum age on which I replaced the valve was 92 years.
Wow.
And this gentleman was very active. He wanted to, because many times people think, why to do something at the age of 92? But who knows, he will live more. And, and people do
Absolutely.
survive.
That is brilliant. Mhm.
This is an option which has really changed the way. And let me tell you, the aortic valve replacement option was labeled as one of the most exciting innovations of medical technology in the last decade.
Okay.
So, yeah, and I'm glad that we have it here in India, and nobody has to travel out of India to get this done.
Fantastic. And I'm sure there must be, beside Medanta, there must be other places also in India. I know that you're doing a lot of sessions for different doctors all over the country also for this.
Yeah, so we are developing. So I started this as the first in a few years back, and so that is why I keep traveling to different places to do these procedures, to teach them, and then of course they can just carry on. So that's how things are.
And I may add for our listeners today, especially, that for the first time you did an angioplasty also in Nepal and in Afghanistan and in so many places. You have a lot of list of firsts like this also to your name. So coming back to some of the questions that I had prepared for today, tell me more about the honor of receiving the Padam Shri and being working with successive presidents. What was that about? And I'm sure it feels great. For us, it's a matter of pride. Was that related to the angioplasty work that you're doing, and how does it work? We don't need names.
Yeah. So basically, as I was mentioning, that when I started my career, cardiology was at an infancy stage in India. And in the last 25 years, and at that time, patients had to go out for treatment outside India, maybe US or UK, etc. And the doctors also had to go out for training in cardiac treatment options, getting trained. And I in fact got trained in interventional cardiology after doing my basic training here in France, because there was no training option here. There was nobody who would train you, or where would you learn these things? And that was the starting point. And the patients had to go, everybody out and spend a lot of money and time, and a lot of people had to travel because it's a bypass surgery. So that was such a huge difficulty. And government was also spending a lot of money on their employees, the bureaucrats, the politicians. Everybody was traveling, and then a huge expense was there. So that is the time when we started doing this whole thing. And today, I must tell you that we have no patients going out of India for cardiac treatment, for even the highest
Fantastic.
level of cardiac. Yes.
Fantastic.
And in addition, now we get patients from almost every country, even United States.
Yes, I saw an article of a couple from the US who came to India, and in fact, they came to you, and that article quotes you also for the kind of treatment you provided.
Yeah. Yeah, I must tell you that was so interesting and surprising. I was in US, and somebody showed me a Time magazine. You say you are here in this magazine. I said, why? So then I saw that there was an article on patients getting treated at 1/10 the price of treatment in United States compared to India. And this patient had come all the way from there, got treatment this 1/10 the price. And so that was quite interesting. That was published in Time in a few years back. And then what happened was that when we started this, and then gradually it progressed, then we established many centers in India. So I used to travel to Bihar, to Rajasthan, to to UP, to Mumbai, to Karnataka, to Hyderabad, and then to outside India. That I had to travel to, of course, some countries in Africa, like Nigeria, then Ghana, and then in Asia, like Taiwan, Vietnam, Thailand, and China was absolutely behind us. So many times I had to go from one city to another city, and this was very interesting. So from Beijing, then to going to, I forget the names of those cities, keep hopping, and then spreading all this information all in all these countries. This was very interesting. Even South Korea.
So, and all these trips were part education to the local physicians and also part treatment of local patients. Is it?
Yes, so it was done on patients locally, but then the doctors got trained in this. So
Okay.
we actually adopted the treatment of heart disease a little early than our Asian counterparts
Okay.
from
Mhm.
all around. And then there was no treatment option in Nepal, there was no treatment option in Bangladesh, nothing in Sri Lanka, nothing in Afghanistan. So I was traveling to Nepal almost every week, like
Okay.
taking a morning flight and coming back in the afternoon and then going to Bihar. So that was very, very, kind of those
Wonderful.
days of interesting.
That's like the
And
life of a pioneer and an
so
adventurer.
the first time we had, when I went to Nepal, in the plane, we had taken the whole equipment, the whole team. And at the, the customs, they were very surprised to see all those things. They said, okay, okay, take it. Because when we
So,
told them,
a lot of questions have started coming in, and in fact, I'll request all our listeners, please post your questions because now we are in the third segment of this conversation where we take the viewers' questions. So please post your questions, and if you're able to give precise questions, we can get precise answers from responses from Praveenji. One of the questions, interesting. Is it possible to reverse heart disease? You know, what is your thought on that? How's the,
you
supposing
know,
somebody's, yeah,
a very interesting question, and whether we can reverse heart disease. Certainly, we can at least stall heart disease. We can control heart disease, and some of it can get reversed sometimes, but not all of them. There are some, new treatment options which have come up where we have seen the reversal happening on investigations. So we have those things, but people have to be very careful about cholesterol because we have seen that if you bring down the cholesterol to a level LDL cholesterol beyond below 50 or 55 in a high risk individual, the chance of having a heart disease goes down dramatically. Like, if somebody is destined to have a heart problem, the chance is 20%, it will come to 2%. So that is the extent of control which we can have. And we
okay,
have such effective medications which can really, bring down these chances. So it is possible, it can be reversed, but the most important thing I told you still is lifestyle. Heart is a lifestyle disease. So if people take care of the life and the lifestyle, it is done.
okay.
80% job is done. You don't need a doctor.
Very, very
You
well
don't need
put. I think
somebody
it's a lifestyle issue. Take care of your
on the lifestyle.
lifestyle, and the heart takes. Another related question, actually, and this comes from a friend in Dubai. The question is age a factor for heart attacks, and so taking care of the heart?
I mean, as I said, that heart disease typically takes time to develop and to get, gradual progression, and the blockage development takes time.
Mhm.
So start the basic investigation or basic, awareness at the age of 30, 35. And when you are at the age of 50 plus, then the test, or not all the tests. Let me tell you, people think that I've done a executive checkup and I'm fine. That's not true. That theory is going down. The most important thing is take care of your life yourself and get a BP checkup done, get a cholesterol checkup done, and that's all. Like many times people do a stress test and a echo and all that. That's not required. So the important things are manage your life better, do your checkups in time, take your medicines for BP and sugar, you are done. You are good.
Okay, so a lot of questions now coming in, so I'll go for some kind of a rapid fire question session. One, although this session is not about COVID, but because COVID-19 is all around us, so can't resist this question. to you. Any special care for heart patients or for the heart in because of COVID-19? Anything specific because of this thing?
Yeah, the precaution is that anybody who has a heart problem or a comorbidity like sugar or high blood pressure, in these people, if there is a symptom, they have to quickly get it checked. Do not try to be in the house and think that it will be okay. Get it checked faster. The earlier you get it detected, the better it is. The chance of getting the response is much better.
Okay.
Because many times people think that let me just be at home and not go out, etc. So do not shy away from going to the clinic. Many times, in fact, my heart patients, they call me and say that can I meet you somewhere outside? I say, what does it mean? So no, we don't want to come to the hospital, we don't want to. I said, that's not right, you have to come here. So they want to meet me in a coffee shop, they want to meet me somewhere outside because they're scared of corona. That's
Exactly.
not actually true.
Possibly thinking that the coffee shop is safer than the hospital, which of course
That's
you and
not
I know
true.
the
Because in
facts.
hospital, we have a very sanitized area, and we know everybody is okay. There is no corona here, so they are better off here. So I tell them, if you are in the hospital, you are the safest.
Okay.
There is
So
no scare.
wonderful. So the next question is related to the vaccine, and of course, there's a lot of speculation, and I know that sooner or later, and maybe in another 6 months or whatever, and I'm not asking you a question on speculation when it will come, but the question is similar to this. There is also the flu vaccine which is available, and people are taking flu shots. Does it really work? Supposing I take a flu shot, does it mean that I will never get flu ever again?
No, that's not true. The flu shots are for that particular time when the flu is spreading. You can take the flu shot. It works. So
Okay.
because the strains of the flu keep changing and there are so many different type of viruses which cause flu, so that is why one flu shot will not be the treatment forever. So it is only for that time duration for a few months and the area where you are coming from, because that kind of flu is spreading there, so you can take that flu shot. So similarly, corona vaccine might be effective once it comes for a particular period of time. It won't be that you have taken a corona shot and then you are done for life. That's not true. But certainly, I presume that
Yeah.
the virus will typically settle down after some time. And must tell you that people should not get scared, because every time historically, if you look, whenever epidemics are or pandemics are not new, they happen. They have happened at those times when we had very little medical support. The medical science was not developed. Still, we survived. And the world comes out better. The society comes out better. So this time also, I am hopeful that we will come out better. Everything will be okay.
Absolutely.
It's a
Absolutely.
matter of
Wonderful. So the next question is from another friend who's about your and my age, I would guess. And so his question is how to check on the blockages, how frequent the test should be conducted, which I
so.
assume that somebody already has some blockages. So
If somebody has a blockage, he
uh,
should continue taking medicines. He should do lifestyle measures and get himself checked if everything is stable once in a year. But if there is a need, if there is, if the doctor is telling that you come in once in every month, so it all depends upon the severity. So whenever I treat a angioplasty, put a stent, then I call them after 1 week, then I call them after 1 month, then I call them after 6 months, and then I call them after every year. So that is the usual pattern on which we
okay,
follow. Yeah, so that we keep their BP under control, their cholesterol under control, and that's it.
okay. Okay. So here's another interesting question. For somebody who's relatively young and progressing in life, what are the symptoms we should look out for heart disease? What are those initial signs कि हाँ यार कुछ हो रहा है इसको check करें?
Yeah. So the initial symptoms are sometimes very, very, mild. They are hidden. They come in a disguise. And those hidden symptoms are, if somebody is like going for a walk every day and suddenly he starts feeling a lumpiness in the throat while walking, or a heaviness in the center of the chest. You see, the heaviness in the center of the chest, or going up to the shoulders at the time of walking or doing exertion or climbing stairs. That is the time when you start when one should start thinking that this could be a heart problem, go to a doctor. The second is, if suddenly somebody starts developing a very severe constricting pain in the center of the chest, and also symptoms of acidity. Acidity is something which is very, comes in, disguises the heart problem. So if somebody is getting acidity and it is not getting controlled with like taking a tablet of Digen and taking a soda or something like that, that means it could be a heart problem. And the second very important thing is breathlessness. If the breathlessness is kind of not responding to anything and it is increasing and someone is getting very short of breath and sweating is happening, and the pallor on the face, peela pad gaya face, that is the time when heart disease should be suspected, and that is a kind of urgency. People have to rush to the hospital. But if these kind of symptoms are happening, which are lesser, which are only happening on exertion, then checkup has to be done by a stress test or something like that.
Thank you. So the next question is an interesting question, although I say this with a bit of caution. It's about, and the question is, as a layman, whatever doctor says, we have to accept. But is there a portal or a website which you are comfortable with, which gives very transparent explanation of the terminologies that doctor use, how to increase one's knowledge? I hope it is not misunderstood as somebody becoming their own doctor. There is no substitute for a doctor and getting proper professional advice. But if somebody wants to, maybe for their own lifestyle care, need some information, where do they go?
Anything I think there are very standard, very kind of proper sites which are there, and one of them is the webmd.com. WebMD, that doctor on the web. So it's a WebMD. The second is there are public information, modules available on American College of Cardiology sites, American Heart Association sites, and Cardiological Society of India also probably has those links. So people can go to that. Those are standard, very sanitized, very correct information, and that is all. Otherwise, sometimes people come with very, very, vague information, which is absolutely incorrect and are, not properly standardized. So that one should stay away from. And because many times, let me tell you example. Many times, if I write a tablet of cholesterol reducing medication, at least 30 out of 100 times, like 3 out of 10 patients will not take it. Why? They will read on the web or on the the internet that statins cause side effects, and they will not realize that these side effects are only in a very small number of patients, and the doctor has to identify those side effects and then only stop it. One of my patients yesterday only, I did an angioplasty. We advised him to take statins, and for 1 year he was not taking it, and then he took it in a very small dose because he will develop side effects. So I asked his wife, why didn't he take it? So she said that somebody said that it will have side effects. I checked on the internet that it leads to side effects, so I didn't take it. That is a problem. It's because every medicine has side effects, and those side effects are very minimal, 99% times. So it is good to be aware, but do not go beyond the advice of the doctor. If the doctor has said, he knows what the side effects are.
Okay. Absolutely. And I think what's the point if you take good professional advice, but then ignore it? The web can be a good place to get information, but not follow all the advice there and overrule the advice from a professional doctor. Another interesting question. This comes from a younger person, about 35 years of age, and says, how often should he go for preventive health checks? And what should be done, what should not be done?
Yeah. So basically, a preventive health check, the most important thing is that one should get a blood sugar test done, a cholesterol test done, a blood pressure check done, and a general examination by a physician. That's all. One doesn't need to go for any fancy investigations like doing ultrasound and doing a CT scan, etc. That's not required, because there are many tests like this, that they are like platinum tests and they are gold tests in many hospitals. They, I don't think, are really required. You just need a basic investigation and a basic check by a physician. And if there is no symptom, there is no previous history of heart disease, there is no family history of heart disease, there is nothing, it's okay. Then you can just carry on, because you cannot prevent those things by doing these steps.
Okay.
So do a checkup once, as I said, at the age of 35 years. Get your BP checked, get your sugar checked, get your cholesterol checked, and a general blood investigation if at all, that's all, and a general examination if everything is okay. No more tests to be done. And then repeat the test every 5 years.
Okay.
But in a patient who is diabetic, who is a heart disease, and who is having uncontrolled high blood pressure, they should check it every year. So that is a usual advice.
Okay. Very well said. I think we're coming to wrap up. There are a couple of more quick questions. One, and I think this is not so much about the healthy heart, but touching another aspect of healthcare in India. That somewhere it seems, and the question is that there seems to be over commercialization of the healthcare practice in India. What is your sane advice for our viewers, how to differentiate between the proper valid requirements and also stay away or steer away from the rather commercial establishments?
I mean, this is a very difficult question to answer, because in every sphere of society, this problem, creeps up very quickly, because, we say that the first cousin of good, who is the first cousin of good? The first cousin of good is bad. So,
okay.
So whenever good comes, the cousin creeps in very quickly. Okay, this is life. So
Okay.
this happens, and we have to use our wisdom, our information, whatever information you have, and the availability to find out what is right and what is wrong. Because I can't say right now that everybody is right or everybody is wrong. But people should realize, now the problem is that commercialization is not that much, I can tell you. It's like 90% everything is okay. 10% maybe, and that 10% also is driven by many factors. Because, for example, the society has become so, difficult that, if you do some investigation, if there's something which gets missed out, then people can come back to you saying that, why didn't you do my angiography, because I developed a heart attack. So more investigations are being done because of societal pressures, because of legal pressures. You know what I mean? Yes. So that is one thing. It is not because of any commercialization. It is more of a compulsive thing that, you have to do it. Because if it gets missed, he will do a legal case on you. So those are some of the issues, but 90% people should have confidence in wherever you are going. If you are not confident, don't take the medicine, don't go to the doctor. But if you are going to a doctor, have confidence to start with. And then if you feel that it is not working out, you can take a second opinion from somebody who is of the same caliber or a better caliber and speciality. Because many times what happens is, if I advise something like angiography to somebody, he'll go and speak to a non-cardiologist, and then he may say, oh, no, it's not required. They say it to everybody. That's not right.
Wonderful.
So this is the problem. So you have to use your own, wisdom and your own
judgment in these things. Yeah.
To steer away from these problems.
Okay, so a few questions, and I can assure all our listeners will try and cover all the questions here, even if you are extended by 5 or 10 minutes. So Praveenji, thank you so much for giving me the liberty to extend by a few minutes because the questions are very interesting. Next question is from someone who's, I guess, taking care of elders in the home. Any special care for patients dealing with Parkinson's disease and heart care for Parkinson's disease patients?
I mean, many patients do have Parkinson's because it is a problem of advancing age. Heart disease is also a problem of advancing age. So these things can coexist in a patient, and both have to be dealt with together. And the heart treatment will carry on. And for Parkinson's, the neurologist has to take care of that. They give medicines, and many times they both can be treated very well and get controlled. So there is no problem. It's okay.
Okay. And is there a correlation between thyroid and heart disease, or any special precautions for
Thyroid,
people
again,
who
as I
have?
said, thyroid is a very common disease these days. And hypothyroidism, which means that the thyroid levels are really going down, and then we need to give thyroid medicines. It is very easy to identify. A simple thyroid test can know this, and many heart patients do have it, and we give it together. There is no problem. So that is the whole thing. Now, let me add a little things. We didn't touch upon the stress factor because that is
Yes.
very. The stress factor is that we have to make efforts, conscious efforts, to reduce our stress and find out what makes us happy. Okay, because stress has been found out to be one of the very important factors for precipitation of heart disease. You must have seen movies where, in Hindi movies, that suddenly you get a bad news and the
Yeah,
person gets a heart attack and dies,
the hero
which,
collapses.
yeah, the hero collapses or hero's father collapses. So the thing is, that is really true, that stress is a very important factor. If it comes in small boluses, it can keep leading to heart blockages. If it comes as a major blow, somebody can certainly. And this, let me tell you, it is very surprising. Many people may not be knowing this, that we have a disease known as broken heart syndrome. अभी तक तो आप सोचते हैं ना broken heart मतलब दिल टूटता है. So a broken heart syndrome is a disease. And we have seen this happen when there is a strong, stressful factor in the family or in the work, and the heart suddenly dilates. And this is a disease, and suddenly the heart becomes weak, and sometimes people can even die. So we have to reduce stress on a daily basis, try to make our life happier, try to find out ways to, reduce the stress on a daily basis. It cannot happen that let me have the stress and then I'll go for a holiday after three months, and then my stress will go away. That's not right.
I think that's a very
Enjoy our
interesting
work.
insight. Yes, that it's not that अभी तो काम कर रहा हूँ, छुट्टी पे जाके stress free हो जाऊंगा. अभी तो let me really go like a full steam engine into this.
Yeah. So we have to, really take our time out and to, on a regular basis, and interact with family, interact with friends, and having at least one friend is very many times people don't have friends. So you must have friend, you must have family, and then interact, discuss your problems with them, and then of course many things get sorted out just with that. So my
Absolutely.
advice is to have a balance in life. Balancing the life is the most important thing, and heart disease is all about balancing the heart and the mind. So if you have a
Absolutely.
balance, heart is okay.
Connecting the head and the heart. I think
Head and the
that.
heart.
One quick last question. There's a term called homocysteine. Is that a condition that's something we need to take care of?
Homocysteine is basically a test which was done very frequently, and let me again tell you, this is a very mal-used test. It is not no use. Homocysteine does tell us that those people who have high homocysteine might have a higher chance of having heart, but you can't treat homocysteine. So
Okay.
as I said, if you take care of your life, homocysteine is taken care of.
Okay.
So
I think
one has to just take it in that way, because many times people come to me with at least a bundle of reports. So I asked them, why did you do this? He said, no, I thought I must get the whole thing done.
uh-huh.
I mean, these reports, you have nothing to do with those reports. They are useless. So it should only be done once they are prescribed or advised, and that is the way to do it.
Absolutely. Thank you so much, Praveenji. I think this has been very, very special for me, and I'm sure for all the listeners, for the kind of questions that we've been receiving. Thanks to the comfort with which you and I had this, my stress levels were under control. And I must say that for me, especially, it's a privilege that Praveen and I are very dear friends. And thanks to our children, actually, I must say, that we have become such good friends. Dr. Chandra's son and my daughter, they met and they decided to get married. So thankfully now you and I are somebodies and we have a lovely relationship. So I think this is a great way to conclude this session. I've seen you
Thank
many times in the last 2 years, and every time I meet you, I see that two things. One, you're always the same. You don't change. Your stress levels are always under control. And the second thing I must say, which I appreciate about you, is whenever any of your patients call, you're always taking their call. So we may be sitting for dinner or out somewhere, and have been with you so many times. You're always dedicated to your patients. I know that today also you had earlier told me you'd be home to receive the call, but I understand that you're still in the hospital because you had more patients to look after. So I think your dedication itself and the way you are conducting yourself and Medanta Medicity is also a lesson for all of us on the lifestyle matters that you mentioned. And in you, we have a great friend. Thank you so
Thank
much to all
you.
the listeners.
Thank you, Vimalji. And before I, sign off, I must also introduce to everybody that you are also a pioneer in your own field of electricity, and you are working on bringing down very new ways of, bringing. I don't know. You're telling about the DC current, and which was earlier, and now you are still trying to bring that because that's much more efficient. And I must congratulate you for being on the International Electric, Consortium and the authority which you are heading for a few years now, and
Yes.
you're so busy all the time. So thanks for this
So
time.
thank you. But the session is all about you and really appreciate this. Thank you so much. Thank you, all the
Thank you.
listeners. You'll get a link to the video, which I'll post in about 2 days. Thank you and have a great weekend. Jai Hind. Happy Independence Day tomorrow.
Thank you. Bye bye.
Thank you. Bye-bye. Bye.